Hi friends, welcome to yet another video on Tutorials Point with me Richa. And today in this aviation module segment, we will talk about aviation first aid. Well, when a cabin crew starts her initial training with a particular airline, she has to undergo a first aid training for close to 10 to 15 days. Now, in this aviation first aid, she has to understand theoretically what first aid is, as well as there is a mock or a theory along with a practical demonstration of first aid. Let's look at this particular segment and understand what is on the agenda today. Well, we'll define what first aid on flight is all about. We will talk about cabin crew's main responsibility during a first aid or emergency situation, dealing with air sickness, shock, epilepsy, dealing with fractures, bleeding, burns, etc. Handling other passengers during a first aid situation. Well friends, I'm very excited to teach you this module. So let's get started. If I have to ask what exactly is first aid, it is something that is very commonly seen not only on the aircraft but even on ground when you want to really help somebody by providing them the first thing which you can get your hands on so that the condition does not get worsened. If we have to give a dictionary definition of first aid, here it is. Well, first aid is the assistance given to any person suffering from a sudden illness or an injury, with care provided to preserve life, prevent the condition from worsening, and as well as to promote a recovery situation. Well, a cabin crew has to act really in a calm, composed and an attentive manner and make sure that she reduces the kind of injury by providing first aid so that the condition does not get worsened and medical help arrives before she can even do anything else. If we have to talk about different kind of first aid situations, let's start with asthma attack. Now, what exactly is asthma and what causes it and what exactly are the symptoms of asthma? Let's take a look. Well, the causes of asthma is a multifunctional disease which may be triggered by an allergy. It could be triggered by exercise, cold air, smoke, or even a small infection can really trigger an asthma attack. What are the symptoms? Well, a person who is having asthma attack will be severe of shortness of breath. He will have some amount of wheezing, coughing, difficulty in breathing. Victim is usually anxious and is afraid that he might be suffocating. In an asthma, generally people have lack of oxygen, and the only way you can help these people is by giving them more oxygen. Let's see what the crew's responsibility is in case of a first aid for asthma. Victim usually has his own medication. He will probably carrying his own pump, the air pump or oxygen pump. So you need to just help out the person or the passenger with his pump. Assist the victim in taking his medication. In case he has any tablets or something, you can just help him, assist him by giving him some water. Administer low flow of oxygen. On the aircraft, the crew has access to portable oxygen bottle. This portable oxygen bottle is to be used to administer first aid to an asthma patient by giving him oxygen on a low flow and never on a high flow, because it can really choke and suffocate a passenger. Ask the passenger to sit in a position which is comfortable for him. Make him not lie down, make him sit in a calm and a composed position. Keep the casualty calm and make sure you keep reassuring them every now and then. Let them not get anxious about it. So friends, this is how a cabin crew will handle an asthma situation. Coming to air sickness, well, this is one of the most commonly seen thing in the flight, wherein people feel nausea, sickness, air sickness, etc. and they start to vomit inside the flight because they feel really sick. So how do you handle such a passenger who's suffering from air sickness? Let's take a look at that. Well, first aid for air sickness is you need to help the passenger choose a seat with a smoothest ride, and preferably it should be mid-aircraft towards the wing or near the wings of the aircraft. These are seats which are really comfortable and will not make the passenger feel nauseated. So avoid giving him seats at the front of the aircraft or right at the back of the aircraft. He needs to be seated mid-aircraft level. eating or rather sitting facing forward while focusing on distant objects. So you need to encourage the passenger to sit or lean a little forward and to focus on an object which is at a distant location. Eating dry crackers, olives or sucking on lemon. You can also help them by giving them some sugar which will help them to not feel nauseated. Providing a carbonated beverage like a Pepsi, a Coca-Cola, etc. will help him to feel a little less airsick. Providing the passenger with extra air sickness bags. It's important that you help them with 3 or 4 extra air sickness bags inside his seat pocket area. That would really help them. Let's come to the situation of shock. Well, what exactly is shock? Shock is a condition wherein a passenger feels sudden illness or stress or some kind of emotional upheaval which really makes them feel upset, and they can have low blood pressure, because of which they might just collapse wherever they are. Shock can be electrical shock or it could be just a normal shock. Let's look at how you will handle passengers by giving them first aid for shock. Well, what you do have to do is do not let the casualty move unnecessarily, drink, eat or smoke. These are things which you have to be very careful of. As a flight attendant, you should not allow them to do this. Do not leave the casualty unattended. Make sure either another passenger or a crew member is with that passenger who is having shock condition. Reassure the casualty in a constant manner. So you have to keep letting them be calm, composed, and just talk them out through it. Treat any causes of shock which can be recommended or remedied. For example, external bleeding. Now, a person who might be having shock might hurt himself and start bleeding. You need to treat the bleeding, because if there is a loss of blood, it can be very devastating and can lead to a really bad emergency situation or a medical condition. So you need to treat, if it's a bleeding or if it's a fracture or if it's a burn, you need to treat that first. Let the casualty lie down. Keep the head low. For shock, it's very important that you make them lie down. Do not let them sit or stand. Make them lie down, and also ensure that the head is kept low so that the blood flow to the head can reach fast. Raise and support the casualty leg. While the head needs to be low, the legs needs to be raised above the level of your head, for the simple reason that you want the blood flow to reach the brain. Loosen the tightened clothing. If in case he's wearing any kind of belt or tie, you need to make sure that you loosen out his clothing. Make it very comfortable for him, because it will help him to feel relaxed and comfortable. So remove any tight clothing for him, and make sure that there is no restriction or constriction around the neck area or the chest area, as well as on the waist area. So this is something that the crew really needs to keep in mind in order to deal with a person who's undergoing a shock condition. Well, talking about fracture, on board an aircraft, you might have a passenger who suffers from a medium or a small or a high level of fracture. Now, what you can do in fracture is there are a lot of equipments available inside a first aid kit, like bandages, etc., which can help to deal with such kind of fracture situation. So let's look at first aid for fractures. Use blankets, pillows, sprints or slings to immobilize the injured area. If it is a leg fracture or it's an elbow fracture or it's a hand fracture, you can use all of these materials mentioned above to make a sling for that particular passenger who's having fracture. Elevate that area if possible. To elevate, it's important so that blood flow can reach that particular area. For added support, carefully wrap pillow around the fractured area and immobilize the joints above and below that particular fractured area. So if for example a particular area is fractured, the parts above and below it needs to be elevated so that blood flow is not restricted and there's a good flow of blood around that area. Secure with a gauze or bandages, etc. are there inside the first aid kit along with a scissor, so a cabin crew can make a kind of a bandage which will help out the passenger. Never apply a sprint or sling too tight. So it has to be a comfortable sling. Do not make it very tight for the passenger. It can get uncomfortable for him. As circulation may be impaired, so you don't want to make it too tight, not make it very loose so that it doesn't serve the purpose. It should just be in a relaxed manner. Friends, coming to a very important part, which is a stroke. Now, what exactly is a stroke? A stroke is happens in a passenger when a particular part of the brain gets ruptured, and because of which blood flow to that particular part of the brain stops. Now, when blood stops to that particular part of the brain cells start to die, and they have less of oxygen, because of which they begin to die and break out. So that is a condition of stroke which is related with the brain. How does a cabin crew manage a stroke situation or condition? Let's take a look at that. Well, first aid for stroke involves check the face by asking the victim to smile. If one side of the face sags, that means he might be having a stroke. So if left or right side of the face is starting to loosen out and is sagging onto one side, it means that the person is having a stroke. Ask the victim to raise both of his hands. If one arm begins to droop down to the body side, the victim may be having a stroke. So this is again one of the way in which you can understand whether the person is having a stroke or not. Listen to the victim's speech. If the victim's speech is sounding sluggish or slurrish, means he is speaking in a very slurrish manner and you cannot understand what the person is saying, it means he or she is suffering from stroke. Check to make sure that the victim is breathing. It's very important that the person should be breathing normally. If not, then that person can get the condition of stroke worsened. If they are not breathing, you have to start with CPR. CPR is cardiopulmonary resuscitation. So you need to start giving him CPR if he's not breathing. If the person is vomiting, make sure that you position him to the side with his arm under his head so that he doesn't choke on the vomit. So you need to position him in such a way that his arm is really not helping, or is rather helping him not to choke onto the vomit that he might be taking out. If the victim's symptoms subside and he appears to be back to normal, do not allow him to resume any normal activity. Now, passengers, after they've recovered from stroke, might be excited to just walk around or do some or the other activity, which is a normal activity for them. A cabin crew needs to restrict that particular passenger by not allowing him to conduct any of his normal activities. In case if required, a crew can assist him. Friends, we will now talk about epilepsy or fits. Now, fits are convulsions or seizures which a person might have, because of which there might be frothing inside the person's mouth and he might be feeling, as if he's in a state of shock. He might fall down and have epileptic fits. Let's take a look at them. Well, for first aid for epilepsy, you need to do the following. Remain calm and stay with the person. The person might not even know what's happening and might get very confused because it might be the first time he or she may be having fits. So you need to reassure the person and really stay with the person. Do not go away anywhere. Time the seizure. It's important that you have a stopwatch with you and time the gap within which the particular fit is happening. The lower the time frame, the better it is, because that means that the seizure is about to get finished. Protect from injury. A person who might be having fit might injure himself or injure others. So you need to seclude them to a particular part of the aircraft. Make them away from passengers and do not let them be in the sight of passengers. It can be very confusing to other people. Roll into a recovery position when the jerking stops. A person who's having fits or seizures can have a lot of jerkiness in the body. His body might just be shivering or jerking. So as soon as the jerking stops, place him in a recovery position. Maintain privacy and dignity. As mentioned before, you need to seclude these passengers into an area of the aircraft, preferably in the galley when other passengers cannot see this particular person who's having fits. Talking about burns and wounds, let's understand how to handle burns and wounds on board the aircraft. Well, friends, there are different degrees of burns. As you can see, the first one is a first degree burn, in which only the upper level of the skin is getting burned, which is the epidermis part of the skin. So that is first degree burn. The second degree burn is when the second layer of the skin, which is the dermis, gets affected, and that is the second degree of burn. Third degree of burn is when the burn really goes deep into the skin, into the third level, which is the hypodermis. Now, for cabin crew, if it is a first or a second degree burn, it can be, you can help out the passenger. But if it is a third degree burn, wherein the burn has really gone to the last level or the depth of the skin in the hypodermis, you really cannot do much about it. So you can treat only the first and the second degree of burn. Let's look at what you can do. Well, if a passenger gets burned, like if a hot or a really hot tea or coffee falls on his hand, or if he gets really hot water falling on him, what you can do is immediately make sure that you put his or her finger into cold water, running cold water for at least 5 minutes. Make sure that you try and apply a little bit of Dettol or antiseptic or Savlon, which will help him relax or cool that particular area of burn. Making sure that you can also bandage it with the help of a bandage and a scissor, as well as a tape which is there inside the first aid kit. So this is something that you can do immediately if a person has a burn or any kind of wound, which will prevent it from really worsening it further. Well friends, certain guidelines for the cabin crew in terms of how do you really handle all these emergency situations with regards to first aid. Well, in a first aid situation, you don't need an MBBS doctor on board the aircraft. The crew is very much trained to handle such situations. Certain guiding factors for the cabin crew is they need to have general update about how do you handle different kind of first aid situations. So their knowledge should be up to date with regards to that. They need to make sure that they know the discovery of that particular thing. They need to have the flight crew known that this person inside the aircraft is having such and such first aid situation. For example, there's a burn situation, or if a person is having epilepsy fit, the captain and the co-pilot needs to know about the situation. They need to assess the situation, whether it's really an okay situation or if it's a very difficult situation and they might to have an emergency landing. So they need to assess the situation if it's okay or not, all right. Diagnose the situation, make a decision with the help of a captain whether any kind of medical emergency or medical help is needed when they land. As soon as they land at the final destination, captain can make a request to the ground staff to have medical help ready or a doctor ready as soon as they land. So that's the guidance that cabin crew needs with regards to any kind of first aid emergency or medical emergency. Well friends, that brings us to a complete conclusion on this particular module on first aid. We sincerely hope you have enjoyed listening to this particular module. Keep watching, more and more videos coming your way. Thank you for listening to us.